Hello, my name is Holly and I'll be teaching you about croup today. Croup is characterized by swelling and irritation of the vocal cords, which in the larynx, the windpipe, which is known as the trachea. This infection typically affects children ages 6 months to 10 years. And in extreme cases, it can also affect the bronchial tubes known as the bronchi. The swelling and irritation are the results of a viral infection, human parainfluenza virus types 1 and 2. Mild cases of croup are related to positive test results of influenza A and B, endovirus, rhinovirus, SARS-CoV-2, respiratory syncytial virus, and measles. Bacterial croup can be caused by Staphylococcus aureus, Streptococcus pneumoniae, Haemophilus influenzae, Moxarella catarrhalis, according to the CDC. Symptoms to watch for are 1 to 2 days of runny nose, coughing, sore throat, ear pain, decreased appetite, irritability, and low-grade fever, preceded by a cough that becomes barky, loss, or scratchy voice, difficulty breathing or rapid breathing with audible stridors, which is heard here. Stridors are a noisy, high-pitched sound from breathing heard in the higher up airways, mostly the upper lungs. Having these symptoms can be scary for a child. As a caregiver, here are some things that you can do to help with your child with croup. Holding your child upright in your lap with hot steam or using a cool mist humidifier will help lessen the respiratory and nasal congestion irritability. Keeping your child calm and relaxed during this will help keep the irritability of the vocal cords and windpipe down. Offering fluids for your child, especially chilled ones like juice or popsicles, can help with the inflammation. For babies, soothing breastfeeding and bottle feeds will help them stay hydrated and calm. Encourage sleep and rest. This will help their bodies to be less stressed and allow their immune systems to fight the infection. If your child has a fever, use infant or child's Tylenol or Motrin in doses appropriate for their weight to keep the fever and pain down. Aspirin is not recommended for children under the age of 3 due to the reaction called Reye's syndrome. According to the Mayo Children's Hospital, it is not recommended to use over-the-counter cold medicines, especially in children under 2 years old, due to the ingredients that could be harmful to the child, and they will not help clear up croup faster. When it is time to seek out medical care. When you see that even the fever reducers are not taking the fever down, and your child is having more and more difficulty breathing with nasal flaring, it is difficult for them to speak, breathe, or drink, and the ribs are notably retracting with breathing. And in rare cases, you will notice a blue tinge to their lips, their fingertips, and their toes when coughing. According to the National Wise Children's Hospital, these symptoms are indicated that something more could be going on. Seeking medical help when this happens is recommended. Make a list of your child's symptoms, when they started, how severe they are, along with if you've noticed any difficulty swallowing, drooling, what medications are prescribed and over the counter that your child is taking, and if they have any allergies. And any questions you have for the provider. It is always a good idea, that way the medical staff can get a good picture of your child's illness and what course to take. The first medication used to treat croup is corticosteroid steroid named dexamethasone. This medication can be given orally in liquid or pill form, or by a single intramuscular injection, based on whether the child's inflammation of their windpipe is too swollen to swallow with no difficulty. Side effects that parents should be aware of for this medication are nausea, vomiting, and upset stomach. Tablets should be swallowed, not chewed, and it can be crushed and mixed with a small amount of food like yogurt or applesauce. If vomiting occurs within 30 minutes of giving the dose, you will have to repeat the dose. If it happens more than 30 minutes from giving the dose, you do not have to repeat the dose. If the corticosteroid is not effective, then epinephrine can be given as an inhaled form using a nebulizer. It is a fast-acting, but only lasts for 2 hours, and the child will have to be observed for that time to make sure a second dose will not have to be given. Side effects of this medication that parents should watch for include fast pounding or irregular heartbeat, tremors, shaking, nervousness, seizures can occur, and difficulty sleeping and staying asleep. Both medications work on reducing the inflammation of the upper airway that causes that barky cough and high-pitched stridors with breathing. Both are used in short-term use for croup.